Welcome back to the channel. If you love powerful ideas, helpful tips, and mind-opening content, don't forget to subscribe and join our community. Attention, gentlemen. Have you caught yourself getting out of bed 3, 4, or even 5 times every single night to use the bathroom? Notice that your urine flow just isn't the same anymore? It's weak, or worse, you feel like your bladder never fully empties? If any of this sounds familiar, then this video is absolutely essential for you. Here's a shocking fact. A huge number of men over 50 make one major mistake every single time they pee. And the most alarming part is that many do it without the slightest clue they're harming their own health. They think it's normal, just part of getting older. But I'm here to tell you that's not the case. Today, I'm going to expose a silent habit that could be damaging your prostate and affecting your bladder's health without you even realizing it. I promise that if you stick with me until the end of this video, you'll not only discover this common mistake that so many men make every day when peeing, but you'll also learn the correct technique you can start using right now, today. The knowledge I'm about to share can bring real benefits to your life. It can help reduce inflammation in your prostate, significantly improve your urine flow, ensure your bladder empties completely, and most importantly, let you enjoy uninterrupted nights of sleep without those constant bathroom trips. This is an issue that impacts men's quality of life far more deeply than most realize. Stay with me and uncover the truth that has the potential to change your bathroom routine forever. I'm Dr. Jane, a urology specialist with over a decade of experience treating patients in various locations. Over the years, I've seen thousands of cases of men suffering in silence with prostate problems. And believe me, many of these discomforts could have been avoided with one simple change in peeing habits. I'm here today to tackle a topic that, though it seems basic, is widely ignored by most men: the correct way to pee and its direct impact on prostate health. Many of you gentlemen might not think it's a big deal, but a bad habit can be the starting point for a host of serious urological issues. This includes conditions like benign prostatic hypoplasia, chronic prostatitis, and that annoying, desperate need to get up multiple times at night to use the bathroom. And let me be clear, my friend. I've heard so many of my patients say, "Oh, Dr. Jane, I'm just getting old. It's normal to get up so many times." No, sir, it's not normal. And it doesn't have to be that way. To help you understand why this mistake is so dangerous and how it affects your quality of life, we first need to cover a bit about anatomy in a simple way without complicated medical terms. Picture your bladder like a water balloon, the kind we played with as kids, right? It's a muscular organ designed to store urine. Right below that balloon is your prostate, a small gland about the size of a walnut that surrounds the urethra, the tube through which urine exits when you go to the bathroom. The prostate acts like a sort of valve that helps regulate urine flow. Now, it's important to know that as we age, and this happens to every man without exception, the prostate naturally tends to grow. And that's exactly where the mistake you might be making every time you pee becomes your worst enemy. Because when you make this mistake, you're putting unnecessary constant pressure on a gland that's already vulnerable from the years. And now, get ready for the revelation. And I promise, gentlemen, listen very carefully because this is extremely important. The most common and most harmful mistake that many men make when peeing, and that's seriously damaging your prostate, is pushing or straining with your abdominal muscles to try to speed up the urine flow. Yes, that's right. That push you do, that force you apply thinking it'll finish faster. I know what you're probably thinking right now, but Dr. Jane, sometimes the flow is really weak. It takes forever to start or it stops. What am I supposed to do? It's totally understandable to feel the urge to push or strain to finish quicker, especially in a public restroom, when you're in a hurry or when you feel like you're almost done, but there's still a little left. I get it completely. I've heard this exact complaint from hundreds of my patients over my 15 years in practice. But let me explain exactly what's happening inside your body when you do this. When you push hard, when you strain like that, you're creating what we call in medical terms a massive counterpressure. Instead of letting your bladder contract naturally, relaxed, and efficiently to expel the urine, you're forcing the whole process in an unnatural way. This excessive pressure you're generating gets transmitted directly to your prostate and bladder. Your prostate, which is likely already a bit enlarged or inflamed due to age, then suffers direct constant mechanical stress every time you pee. Imagine you're giving your prostate a little punch or shove several times a day, every day. This repetitive constant stress can significantly worsen prostate swelling. And what's even worse, much worse, is that it can cause what we call urine reflux. What does that mean? Picture the urine, instead of flowing naturally outward, getting pushed back due to the pressure you apply, creating a buildup of stagnant fluid inside your bladder. What I'm describing is known in medicine as incomplete urinary retention or post-void residual. And here's the serious part, my friend. This residual urine that doesn't get eliminated, that stays in there, becomes the perfect breeding ground. A real petri dish for bacteria to multiply. This dramatically increases your risk of recurrent urinary tract infections. And those infections in turn cause even more inflammation in your prostate. Can you see how this creates a true vicious cycle? It's like a wheel that just keeps spinning. Pressure, inflammation, retention, infection. More inflammation, more pressure. A cycle of discomfort and chronic damage that can last for years if you don't break it now. And pay close attention, because here's another pretty serious consequence of this bad habit. Constantly pushing confuses your bladder and all the muscles that control it. There's a main muscle in your bladder called the Druser muscle. This muscle is responsible for contracting to expel urine naturally. But when you constantly help it by pushing with your abdominal muscles, what do you think happens? Well, that detrusor muscle gets used to it. It becomes lazy, loses its efficiency. Over time, this muscle loses its natural tone, its strength, its ability to contract fully on its own, without external help. In medicine, we call this a lazy bladder, or hypoactive bladder. And the result, gentlemen, is that you start feeling an urgent need to pee much more often. Even if you just went to the bathroom half an hour ago, because your bladder never fully empties, there's always something left inside. And of course, this forces you to get up 3, 4, 5 times during the night, interrupting your sleep and ruining your rest. And don't tell me it doesn't affect you, because I've seen it in my patients. When you don't sleep well, your energy tanks, your focus suffers, your mood gets irritable, and your overall health deteriorates little by little. This bad habit isn't just harming your prostate, my friend, it's stealing something priceless. Restorative sleep and that feeling of complete relief after fully emptying your bladder. Now, before you think, "Oh no, Dr. Jane, am I doomed?" There's no fix. Let me give you the good news. The solution exists. It's simple, natural, completely free, and available to all of you. But yes, it requires discipline, awareness, and consistent practice. The correct technique you should adopt starting today is called relaxed urination. And here's something you should always remember. Peeing is an act of deep relaxation, not effort or force. Listen carefully to these steps I'm about to give you. When you feel the need to pee, go to the bathroom right away. Don't hold it in. Don't wait until the urge becomes unbearable. Once you're in the bathroom, take your time. There's no rush. No one's chasing you. Instead of pushing with your abdomen like you've done your whole life, do the opposite. Completely relax your abdominal muscles and your pelvic floor muscles. Imagine you're just allowing the urine to come out, letting it flow on its own, letting gravity and your body's natural relaxation do all the work. Don't force anything at all. Focus on your breathing. Breathe deeply and slowly. Relax your shoulders, relax your chest, relax your diaphragm, and just let the flow start and finish naturally on its own. And now comes something really important that I want you to burn into your mind. If the urine stream stops before you feel like you're done, please resist that almost irresistible temptation to push to get out what's left. Just wait a few seconds in silence with your bladder completely relaxed, no tension at all. This gives your detrusor muscle a second chance to contract on its own and expel the remaining urine without creating that harmful pressure I've been explaining. This patience, this mindful waiting is the absolute key to your long-term prostate health. Now, to help you adopt this crucial habit and truly protect your prostate, I'm going to give you 3 additional tips that are absolutely vital and that I've seen work wonders in my patients over all these years of practice. Listen carefully because they can change your life. First, your peeing position.
I know many men prefer to pee standing up because it's quicker, more comfortable, more practical. But if you're already experiencing prostate problem symptoms like weak flow, that annoying dribbling at the end, or constantly needing to go every hour, then you need to know this. Multiple scientific studies have shown that peeing while sitting is the most efficient, most recommended position for achieving complete relaxed urination and ensuring your bladder empties 100%. The sitting position helps a lot in relaxing all the pelvic floor muscles, making urine flow completely natural without any effort. I know culturally, for many men, it might be taboo to admit they pee sitting down, but believe me, your prostate will thank you enormously. This isn't about your masculinity or anything like that. It's about your health, your well-being, being able to sleep well at night. Second super important tip, never ever rush. Take all the time you need in the bathroom, even if it's just 30 seconds, a minute, or up to 2 extra minutes. If you're in a hurry at that moment, it's much better to wait and go to the bathroom later when you can really dedicate the time needed to do it relaxed. Rushing is your enemy, my friend. Your prostate needs you to be patient with yourself. And third, here's an advanced technique that few people know about, but that's extraordinarily effective. Double voiding. What does it involve? After you've finished peeing in a relaxed way, without rushing, without pushing, lean slightly forward while still sitting or standing and wait another 5 to 10 seconds. Often this simple lean allows the expulsion of that residual urine that didn't come out the first time, ensuring a much more complete bladder emptying and significantly reducing how often you need to go to the bathroom. Now, I want to answer a question that several of you have asked me in comments on previous videos because I know it's a very common doubt. Some ask, Dr. Jane, but if I don't strain, I feel like it doesn't all come out and then a little leaks into my underwear afterward. What do I do? Is there some prosthesis or device I can use to fix this? Great question, gentlemen. Let me explain. First, that post-pee dribble you're feeling is precisely from the residual urine retention I explained earlier. The solution isn't to push harder, it's the opposite. Apply the double voiding technique I just taught you. Wait those extra seconds. Lean forward. Let your body naturally expel that urine trapped in the urethra. Now, regarding devices or prostheses, yes, there are medical options for severe cases of benign prostatic hyperplasia. There are urethral stances, which are like small tubes that keep the urethra open. And there's also a relatively new procedure called UroLift, which uses small implants to lift the prostate tissue that's obstructing the flow. And this is very important for you to understand, these procedures are for truly severe cases when the obstruction is really bad. Thanks for watching. If you enjoyed this video, please like, share, and subscribe for more amazing content. See you in the next video.